Hi, my name is Maddie. I'm going to be your nurse today. What would you like to be called?
Hannah.
So this is going to be a lengthy exam. It's head to toe. It's going to take about an hour. Would you like to empty your bladder first?
I'm okay.
Okay. So I watched the patient walk into the room. Her gait was smooth and steady with ease of the extremities. I'm going to go ahead and start with the general survey. First, I'm going to ask you a few questions. What's your name, date of birth, and what year is it?
Hannah Gilbert, 7/5/99, and it's year 2022.
Patient is alert and oriented to person, place, and time. If you had blue lights behind you, what would you do?
Pull over.
Okay. Judgment is intact. Now I'm going to go ahead and do a general survey of you. So patient has good hygiene. She is erect and her posture is erect and symmetrical. Patient's head is symmetrical to the rest of the body. Now I'm going to go ahead and look at your head. So first I'm just going to look at your scalp. I'm just going to feel scalp is clean, good hygiene. Her skull is rounded with no infestations or sutures. Her hair is clean, blonde, silk, and smooth. Now I'm going to go ahead and move to your face. All of her facial extremities are symmetric. Now I'll go ahead and go to your fill of your sinuses. So fill of your frontal, any pain or tenderness, your maxillary, pain or tenderness, okay. We'll go to your eyes next. So first, I'm just going to have you close your eyes. You can open it back up. So the eyelids close completely over the eyes. Her eyelashes are evenly distributed and go upward away from the eyes. Now I'm going to have you look at my finger and look at the wall, back at my finger, back at the wall. There we're testing her accommodation, and her eyes constrict like they're supposed to. They're perla. Her pupils are about 4 millimeters round bilaterally. So now I'm going to go ahead and test for your direct and consensual response. So I'm going to have you just look straight at my nose, and I'm going to shine a light twice in both eyes. Okay. Okay, so the left eye constricts. Okay. The right eye constricts as well, so the direct and consensual response is active. Now, you're going to go ahead and do the Rosenbaum card. So I'm going to have you hold this about a foot in front of your face and cover your left eye. And read the smallest line that you can.
937-826.
Okay, so the right eye is 20/25, and I'm going to have you do the same thing with the opposite eye.
428-365.
Left eye is 20/40. I'm going to do the same thing with both eyes.
426739.
Perfect. And so both eyes are 20/20 vision. Also, I'll go ahead and do your vitals. We do not have a thermometer here right now, so I'm not going to do your temperature today. But I'm going to go ahead and feel for your pulse and respiration. So just feel for 1 minute. Your pulse is 78 and your respirations are 18. I'm going to go ahead and do blood pressure. Pulse is 118 over 76, which is great. Not pulse, blood pressure. Sorry. And I'm going to finish looking at your eyes real quick. So her sclera is white. There appears to be no vessels in it. I'm going to pull down. Just look at your conjunctiva. Conjunctiva is nice and pink and moist. Okay. I'm also going to look at your red reflex. And our ophthalmoscope is currently not working. So in order to do this, I would just have the patient look at me. I would use my right eye to look at her right eye, looking through the light, looking for a red reflex, and I would do the same thing on the left, using my left eye to look in her left eye, looking for the same red reflex. The red reflex is normal, and that's what we would like to see. I will now look at your nose. So her nose is symmetrical. There are no deformities, no deviations. I'm gonna have you lean your head back. Okay, so both NURs are open. The turbinates are nice and pink. The septum is not deviated, and it's very symmetrical. And we'll move on to your ears. So first I'm just going to be palpating your ears. So I'm just feeling the tragus, the pinna, and the mastoid. Any pain or tenderness? Okay. Now I'm going to go ahead and look inside of your ears. Like I said, the otoscope the light is also not working, so I'm just going to show you guys how to use it. Since she is an adult, I will pull her pinna up and back, so we'll just be looking inside to look for fine hairs, for cerumen, and we're looking at the tympanic membrane and for the cone of light. So I'll just look, making sure that the point is toward her nose. The tympanic membrane should be nice and pearly gray, and the cone of light should be visible in both ears. So I would do the same thing over here. Now I'm going to go ahead and move on to your mouth. Her mouth is symmetrical. It has no crusting or dryness. Her lips do not. I'm going to have you open your mouth. Her teeth are white. They're symmetrically aligned. There are no missing teeth. Her tongue is nice and pink and rough. And I'm going to have you say aw for me. Her uvula rises when the patient says aw. Her soft and hard palate are intact. Her gums are nice and pink and moist. Okay. Now we will move on to your neck. So first we will, I'm going to feel over your carotid arteries. Okay. Carotid arteries are +2 on both sides of the middle of the bruise in them. Just breathe normally for me. No bruises are heard bilaterally. I'm just going to be feeling every trachea. Her trachea has no deviations. It is symmetrically aligned. Now I'm going to have you take a drink for me, and I'm going to feel over your thyroid. Okay. I felt over your thyroid as she swallowed. There are no deviations, no excess deformities with that. So now I'm going to go ahead and feel for your lymph nodes. So we will start with preauricular, postauricular, occipital, tonsillar, submandibular, submental, posterior cervical, deep cervical chain, and superficial cervical. and then supraclavicular. Any pain or tenderness? Okay, good deal. Now I'm gonna go and do your hearing, the whisper test, because I forgot to do that too. So what I'm gonna have you do is cover your right ear, and I'm gonna whisper 3 words, and I'm gonna have you repeat them. 1, 2, 3.
1, 2, 3.
Good deal. Now I'm gonna have you do the same thing on the opposite side. 3, 2, 1.
3, 2, 1.
Okay, the whisper test is passed bilaterally. So now we'll move on to the upper extremities. So I'm just gonna have you lay your hands out, kind of like that. I'm gonna start looking at the hands first. There appears to be no tenting bilaterally. There's no edema in the arms. The temperature is nice and warm, dry, and consistent with the rest of the body. I would then look at her fingernails. She currently has no polish on, so I can't do capillary refill, but I would press on each of her 10 fingers and make sure the capillary refill is less than 2 seconds. I would also inspect each nail, making sure that they're about 160 degrees with no clubbing. And hers look good. So now we will go ahead and feel for pulses. So we'll do brachial pulses first. So feel for each of them. Okay, brachial pulse. And we'll do brachial up here and then radial. So we'll do brachial. Her brachial pulses are +2. Let's do radial. Radial pulses in the right arm are +2. Radial pulses in the left arm are +2. And radial pulses brachial pulses in the left arm are +2. Now I'm gonna feel for lymph nodes in your arms. So I'm gonna have you raise your left arm for me. Okay, we'll start with central. So we'll do central, lateral, pectoral, subscapular, and then I'm gonna have you raise like this, and infraclavicular. Any pain or tenderness? Good deal. I would do the same thing on the opposite side, but now I'm gonna go ahead and I'm gonna go to your back. So I'm gonna have you scoot to the back of the bed, and we're going to listen to I'm just gonna begin inspecting. So I'm just gonna feel down your back, feeling your sinus processes and your paravertebral muscles. Is there any pain or tenderness? Good deal. I would inspect the color, the condition, the skin condition of the back. Since she does not have a gown on, I cannot do that, but I would easily undo the gown to be able to fully look at her back. I'm going to test for chest expansion, so I'm just going to put both my hands on her lower back and have you take a deep breath. Okay. Chest expansion is symmetrical bilaterally. I'm also going to look at her AP diameter, which is 1 to 2, which is normal. So then I'm going to go ahead and I'm going to percuss. So I'm just going to take 2 fingers and I'm going to lightly tap on them on 10 spots of your back. Just let me know if there's any pain or tenderness. Any pain or tenderness? Okay. The lungs are resonant in all 10 areas. Now I'm also going to feel for CVA tenderness. So I'm just going to take my hand and I'm going to lightly hit on it, but let me know if there's any pain or tenderness. Any pain or tenderness? Okay. I'm also going to go ahead and listen to your back. As I put my stethoscope, I'm going to have you take a deep breath through your mouth. Deep breath. Deep breath. Another deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And one last. Lung sounds are clear in all 10 areas bilaterally. Perfect. Go back to this side. Okay, now we are going to move to your anterior chest. I'll have you lay back. Let's see. Go ahead and cover you up. If we had a gown, I would easily unbutton the tops just so that I'm able to look at your chest. So we'll be looking for symmetry of chest expansions, looking at the skin color, the temperature, to make sure that the patient's not having any retractions, any bulges, or non-symmetrical chest movements. Prior to doing this, I would also go ahead and do the breast exam. In this head to toe, we are not doing the breast exam, so I will just talk about it. So first we would inspect the breast for size and symmetry. We would utilize the 3 positions to bring out dimpling, so arms out, arms on your hips, and arms above your head. We would have the patient position the patient with their arm up and a pillow under their scapula, and we would make sure to palpate all of the quadrants, including the tail of the spine, tail of the sphinx, and the nipple. We would also encourage doing self-breast exams monthly after your period, preferably in the shower or lying down, and making sure you compare breast side to side. So now I'm going to go ahead and go to the chest. So like I said, we would do a skin assessment. We would check for some symmetry, retractions, any kind of bulges, and we would observe for rhythm and effort. So her rhythm appears to be equal bilaterally, very symmetrical, and she has a very unlabored breathing. So now I'm going to go ahead and auscultate the 8 areas. Just take normal breaths for me. So her lungs are clear bilaterally in all 8 spots. And now we're going to go ahead and move on to the heart. So I'm just going to, it is time. I would go ahead and make a tube top with, if she had on a gown. Since she does not, I'm just going to go over her t-shirt. But this would help keep patient privacy. So first I'm just going to feel for the PMI. I would be looking at the chest, watching for any pulsations, lifts, heaves, or thrills. So now I'm just going to go ahead and palpate for the PMI. And okay, the PMI is about a +2 with a smooth and steady rate and rhythm. So now I'm going to go ahead and listen to the 5 spots of the heart. We'll start with the aortic, which is at the second right intercostal space at the sternal border. I will then go to the pulmonic, which is at the third left intercostal space at the sternal border. I will then listen to herbs, which is the third left intercostal space at the sternal border. Then tricuspid, which is the 4th left intercostal space, sternal border. And then lastly, the mitral, which is the 5th left intercostal space at the midclavicular line. While I'm down at the mitral, I will go ahead and listen to the apical heart rate for 1 minute. 78 beats per minute, and I'm going to turn my stethoscope over to the bell, and I'm going to listen for bruits in the exact same 5 spots. There were no bruits noted. The heart's rhythm is smooth and steady and symmetrical throughout. I'll then move on to the stomach. Like I said, since she does not have a gown on, I'm just going to assess through the t-shirt, but I would look for temperature, check the skin to make sure that there's not any lesions, bruising, or pulsations. I would also look for movement and contour. I will then listen to bowel sounds, and I'm going to have you flex your knees, yes. There are bowel sounds heard in all 4 quadrants. I'm now going to feel for your aortic and femoral pulses. Alright, and I'm also going to listen to the aortic, the femoral, and the renal arteries for bruits. Okay, there are no bruits heard bilaterally. I will then begin percussing all 4 quadrants. Let me know if you have any pain or tenderness. There is tympany heard in all 4 quadrants. I will now begin light palpation, so if you have any pain or tenderness, let me know. Any pain or tenderness? No pain or tenderness noted with light palpation, so now I'll begin deep palpation, feeling for masses. Any pain or tenderness? Okay, no pain or tenderness noted with deep palpation, and there were no masses felt. So now I'm going to go ahead and be feeling for your liver border. So I'm just going to have you take a deep breath in. Okay, breathe back out. Good. So the liver border was not able to be felt, which is good. So now I'm going to feel for rebound tenderness. So all I'm going to do is have you take a deep breath. I'm going to stick my hands in. When you breathe out, let me know if there's any pain. Okay, take a deep breath. Okay, any pain? Good. So there is no rebound tenderness noted. So now I'm going to have you do a hernia assessment. So what I'm going to have you do is lay flat on your back and look at your toes. Okay, so you can lay back down. So if there were to be a hernia, there would be bulging in the stomach. There is no bulging in the stomach when the patient laid up, so there is no hernia noted. Now I'm going to go ahead and look at your lower extremities. I'm just going to Alright, so first I'm just going to inspect the legs, feeling for edema, which there's no edema noted. The temperature of her legs is nice and warm, and they're dry throughout. I'm going to go ahead and take off your socks. There's no tinting noted in the patient's feet. I would normally look for capillary refill, but since she has toenail polish, I'm not going to, because I won't be able to see it. But I would check it in all 10 toes, making sure that it's less than 2 seconds. I'm also going to inspect her toenails, making sure that they're 160 degrees, which they are, and that there is no clubbing. So now, put your socks back on, because I have to stand up. now we will go ahead and we would be doing the testicular exam. Since my patient is not a male, I would not do it on her, but in this video I'm going to go ahead and explain it. So first we would inspect the penis and the scrotum for hair distribution and skin characteristics. We would palpate the penis, noting tenderness or masses. We would inspect the urethral meatus and for discharge or masses. For discharge and for location, sorry. And we would also palpate the testes, the epidermis, and the vas deferens for size, tenderness, and masses, and we would teach a self-exam. So we would teach them what to look for, what's good and what's bad. We would teach them to do it monthly and to do it in front of a mirror or in the shower. So now we're going to go ahead and move on to the cranial nerves. Also, before we go to the cranial nerves, I forgot to fill up your pulses and your feet. So we would fill up the dorsalis pedis pulse on the top of the feet. And her pulses are +2 bilaterally, and the posterior tibialis pulses, which are also +2 bilaterally. Sorry. Okay, so first we'll start with the optic cranial nerve. So what I'm going to have you do is close your eyes. This is testing your nose. So I'm going to have you smell 2 different things and have you tell me what they are. So if you will hold your left nostril. If this, let me know what it is.
Garlic.
Okay, and on to the next. So do the same thing on the opposite side.
Cinnamon.
Perfect. So cranial nerve number 1, olfactory, is intact. Now we're going to move on to cranial nerve number 2, which is the optic. So we're going to test your visual fields by confrontation. So what I'm going to have you do is close one right eye, and I'm going to show you numbers in 4 different fields, and I'm going to have you tell me what they are.
1, 2, 3, 4.
Okay, and do the same thing on the opposite eye.
5, 4, 3, 2.
Perfect. So cranial nerve number 2, optic, is intact. So now we'll move on to cranial nerves 3, 4, and 6, which are the oculomotor, trochlear, and abducens. So what we're going to do are the 6 cardinal fields of gaze. So what I'm going to have you do is look straight at my finger, and I'm going to have you follow it. Perfect. So there was no nystagmus noted while you were following my finger. So now we will do the cover and uncover test. So what I'm going to have you do is cover your right eye and look straight at my finger. Okay, and uncover. Perfect. And then do the same thing with the opposite. And uncover. Okay, so what I'm looking for there is nystagmus, moving of your eyes, and there was none noted there. So cranial nerves 3, 4, and 6 are intact. So those are the oculomotor, trochlear, and abducens. So now we'll move on to cranial nerve number 5, which is the trigeminal. So now I'm going to be looking at your temporal and your masseter muscles. So I'm going to have you clench your teeth. So I'm just going to be feeling of your muscles. Okay, your muscles have nice, good strength. So now I will look at your forehead, your cheeks, and your chin, and we're going to do light touch and pain. All I have here currently is light touch. We do not have a pain sensation available, but normally we would use pain on the other hand to see what you, if you're able to feel both. So I'm going to have you close your eyes. I'm going to touch this in the 3 different spots that I mentioned, and I'm going to have you tell you whenever I touch it, or you tell me whenever you feel it.
Feel it, feel it, feel it, feel it.
Okay, so cranial nerve number 5, trigeminal, is intact. So now we'll move on to number 7, which is the facial nerve. So what I'm going to have you do is smile for me and clench, let's see, raise your eyebrows, I'm sorry, and act surprised. Good. Okay, so there we're just observing for exaggerated facial expressions, so cranial nerve number 7 is intact. We'll then move on to cranial nerve number 8, which is the auditory. So we'll do the Weber test and the Rene test. First, we'll do the Weber test. So what I'm going to do is I'm going to make this tuning fork vibrate, and I'm going to set it on the top of your head. I want you to tell me if you can hear it equally in both ears. Can you hear it equally?
Yes.
Okay, perfect. So now, for the Rene test, I'm going to do the same thing. I'm going to hit it just like I did. I'm going to put it right here on the bone behind your ear. Let me know whenever you can't hear it anymore, and then I'm going to move it right here. And I want you to do the same thing. Just let me know whenever you can't hear it.
I can't hear it at all. Hold on. Can't hear it. Can't hear it.
Okay, we'll do the same thing on the other side.
Can't hear it. Can't hear it.
Perfect. So the purpose of that test is because air conduction is longer than bone conduction. So since you could hear it longer, whenever it was no longer on your bone, it means that you passed. So cranial nerve number 8, the auditory, is intact. Now we will do cranial nerve number 10, or 9 and 10. So that is the glossopharyngeal and the vagus. So first I'm just going to be looking at your uvula. So I'm going to have you say ah. Okay, perfect. And I'll have you take a drink. Oh, sorry. I forgot that's not. Have you take a drink. And just looking at your swallowing, so your swallowing is intact.
If I wasn't sick, I'd probably.
It's okay. So I would also be doing gag reflex. I'm not gonna gag, but we would use a tongue depressor and gag the patient. So cranial nerves number 9 and 10, the glossopharyngeal and the vagus are intact. So now we will do cranial nerve number 11, which is the spinal accessory. So what I'm going to have you do is I'm going to put my hands right here and I'm going to have you shrug your shoulders. Perfect. And then I'm going to put my hand right here and I'm going to have you turn your head against mine. Okay. And same. Perfect. So strength is there, and we're all just doing that against resistance. So cranial nerve number 11, spinal accessory, is intact. And then lastly, cranial nerve number 12, which is hypoglossal. And this, we're going to observe your tongue. So have you stick your tongue out, and so your tongue is symmetrical, and move it side to side and up and down, and move it. Okay, perfect. So the tongue has good strength and movement, and it's symmetrical in the mouth. So cranial number 12, hypoglossal, is intact. Okay, so now we're going to move on to the musculoskeletal. So I'm going to have you stand up for me. So first, I'm going to have you turn and face that way if you don't mind. So first we're going to observe the shoulders and the iliac crest lines, or iliac crest for alignment and symmetry, and looking for any kind of deformities. Hers are very symmetrical. We're also going to look at your back, so I'm just going to feel over your back, and then I have you lean forward and touch your toes. Okay, perfect. You're able to stand back up. So there we're just looking for scoliosis, and the patient has no scoliosis noted. So we're also going to be looking at the cervical, thoracic, lumbar curves of the spine. So we got cervical, thoracic, and lumbar curves of the spine, and hers are all normal and natural. So now I'm going to have you turn around for me. So now we're going to be assessing for TMJ. So that is in your mouth. It's like whenever you open your mouth, it's like popping. So I'm just going to put my hands right here. So I'm going to have you open your mouth. Okay, close it and open one more time. Okay, so there is no popping, no crepitus noted when the patient opens their mouth, so TMJ is not noted. now I'm going to test for range of motion in your cervical spine, so just in your neck. So I'm just going to hold my hand like that, and I'm just have you wear your head to the side, and the same thing over here. Okay, and go side to side, up, down. Okay, and I'm going to do the same thing. We're looking for range of motion in your spine, so I'm going to have you turn this way, go forward, and back. Perfect. Okay, so now I'm going to assess the strength of your sternocleidomastoid and trapezius muscles. So we're gonna do the same thing again. I'm gonna have you go down and this way, and then go up. Perfect. So there is 5 out of 5 strength in her sternocleidomastoid and trapezius muscles. So now we're gonna test your strength in your upper and lower extremities. So first, I'm just gonna have you do a few things with your hands. So wiggle your fingers, roll your wrists, and bend your elbows, and move your arms. Perfect. So now we're gonna go ahead and we're gonna do your muscle tone in your hands. So can you push up, push down? Okay. Let's put your arms like this. Pull towards you. Okay. Push against me. Perfect. And then let's do up. Okay. Perfect. So now let's go to I'm gonna have you. Let me see your hands. So I'm gonna have my hands like this, and I want you to pull on my hands. Perfect. My fingers. So that's just testing your grasp and your strength in your fingers also. So strength is 5 out of 5. Patient has good muscle tone bilaterally. Grasp is 5 out of 5, and there's no resistance. There's no crepitus in her upper extremities as she was moving. There was no popping. There was no failing, and I'm just going to feel over your joints just to make sure. Perfect. All right. So now we're going to move on down to your feet. So first I'm going to have you wiggle your toes. Okay, and move your ankles. Okay. Bend your knees. And then move your legs like that. Perfect. So that's just testing range of motion in your hips, knees, ankles, and toes. So now I'm just gonna kind of feel over your area. So I'm gonna have you sit down. Okay, we're gonna do the strength in your legs. So first, I'm gonna push up on your feet, push down with your feet, push out with your shins, push in, and up with your knees. Okay, perfect. So strength is 5 out of 5. In the lower extremities, there appears to be no crepitus, and patient has full range of motion in upper and lower extremities with good grasp and good resistance. So now, lastly, we're going to move to the cerebellar and sensory test. So if you don't mind to stand up, and I'm going to have you walk towards me and walk back. So that's just checking your gait and your balance. The patient has smooth and steady gait with ease of the extremities and appears to have good balance. We're now going to go ahead. Her posture is erect. Patient appears to have no deformities or anything else. So we're going to go ahead and do the Romberg test. So what I'm going to have you do is just stand there with your feet beside each other, and close your eyes. Okay. And so I'm just watching to make sure that she's not swaying. Okay, you're good. So the Romberg test has passed. And now I'm going to have you do 2 different things for me. So this is just testing looking at your balance. So I'm going to have you hop on one foot. And, or hop and then stand on, hop. Just, okay, we'll hop. Okay, I'm sorry. And then stand on one foot. Okay. And stand on the other. Perfect. So the patient has good balance in her cerebellar is intact. So now we're going to look at fine motor coordination. So I'm going to have you do 2 different things. Do finger to thumb. Perfect. And then finger to nose. Good. Okay, so cerebellar and sensory is intact. Now we're going to go ahead, and you can have a seat. So we're gonna go ahead and do test your sensation in your upper and lower extremities. So we're gonna do the same test that we did earlier with your eyes closed. We're gonna feel the sharp or the soft versus sharp. Like I said, we don't have the sharp, so we're still just gonna do the soft. I need you to just let me know whenever you feel it.
Okay.
So now have you close your eyes and feel it, feel it, feel it, feel it. Perfect. So the patient has good sensation in her upper extremities, and this would be the light touch, so the pain would be something stronger. Okay, and so we're gonna do the same thing in your lower extremities. Feel it, feel it, feel it, feel it, feel it, feel it. Okay, perfect. So the patient has good sensation in her upper and lower extremities. So now we're gonna move on, and we're gonna do a test called sterognosis. So what I'm gonna have you do is close your eyes.
Okay.
And I'm gonna put two different objects in, or a different object in each hand. I want you to tell me what it is.
Tuning fork.
Correct.
Pin light.
Perfect. So sterognosis is intact. So now we'll go to graphesthesia. And I'm gonna draw two letters into your hands, and I want you to tell me what they are. A letter or a number.
A. 3.
Perfect. So graphesthesia is intact. So now we are going to do your deep tendon reflexes. So I'm just gonna have you have a seat there for now. And first I'm going to start with your brachioradialis. Sorry, that word's gonna. Okay, so I'm just gonna have you hold your hands out like that. Ready? Actually. Perfect. So the patient's brachioradialis reflex is about a 2+. So now we'll move on and we'll do the biceps. So patient's bicep. Okay, patient's biceps are about a 2+ also. So for this next one, this is triceps. I'm just gonna have you like dangle your arm down like that. Okay, patient's triceps intact. Okay, perfect. Patient's triceps about a 2+. And we'll go into patellar. So this is just in the low of the knees. Okay. Patient's tricep is about a +2. And then lastly we'll do the Achilles. So I'm gonna bring this chair over here, and I'm going to have you actually, while you're still sitting there, after the plantar and Babinski reflex, I'm just gonna go ahead and do it. So I'm gonna run this on the bottom of your foot, and we'll see how your foot reacts. And you're not ticklish at all. So the patient has a negative Babinski reflex, which is exactly what we want. And then we're gonna do her patellar reflexes.
That's small.
And so just have her sit on the back of the chair with her foot. All right, patient's patellar reflexes are +2. Perfect. Okay, I'm gonna go look at my paper. Okay, there's one thing I forgot to do, so we're just gonna check the patency of your nose. So I'm gonna have your nose on one side and breathe. And do the same thing on the opposite. Okay, I think that's it. So the patient is patent. The nostrils bilaterally.